What are the key considerations when providing palliative care for pediatric patients, especially those with complex conditions like congenital diseases or terminal illnesses? Answer: when providing palliative care for pediatric patients, the nurse must address both the physical and emotional needs of the child as well as the family. Key considerations include age-appropriate communication. Children's understanding of illness and death varies by developmental stage. Nurses must tailor their communication style based on the child's cognitive abilities. Family involvement. Palliative care in pediatrics requires close collaboration with family members to ensure that they are well supported emotionally and educated about care options. Symptom management. Managing pain, nausea, and other symptoms while balancing the side effects of medication is crucial in pediatric palliative care. Opioids, such as morphine, may be prescribed, but dosages must be adjusted based on the child's age and weight. Cultural and spiritual needs. Nurses must respect the child's and family's cultural and spiritual beliefs, incorporating them into the care plan where appropriate. Relevant guidelines. The American Academy of Pediatrics guidelines emphasize the importance of holistic care for pediatric patients, including psychological, spiritual, and physical support for both the child and family. What are the key legal and financial considerations when managing end-of-life care for a patient who is nearing the end of their life? Answer: key legal and financial considerations include advance directives. Legal documents such as living wills and durable power of attorney (DPOA) provide guidance for healthcare decisions when a patient is unable to make their own decisions. A living will outlines the patient's preferences for life-sustaining treatments, while DPOA designates someone to make decisions on behalf of the patient. POLST, physician orders for life-sustaining treatment. POLST forms are critical in guiding emergency medical services and other healthcare providers regarding the patient's wishes for life-sustaining treatments. Financial implications. The costs of hospice and palliative care can be substantial. Families must consider insurance coverage, Medicaid, or other financial assistance programs. Hospice services are generally covered under Medicare for eligible patients, but patients may require guidance to navigate these options. Relevant laws. The Patient Self-Determination Act (ESDA) requires healthcare providers to inform patients of their rights to make advance healthcare decisions and to provide information about advance directives. What are the key challenges when providing palliative care for a patient with dementia, and how can these challenges be addressed? Answer: palliative care for dementia patients presents several challenges. Communication difficulties. As dementia progresses, patients may lose the ability to communicate effectively, requiring caregivers and nurses to use nonverbal communication strategies, e.g., touch, eye contact, and facial expressions. Behavioral symptoms. Dementia can lead to agitation, aggression, and confusion. Non-pharmacological interventions such as cognitive stimulation, routine establishment, and validation therapy are often employed to manage these behaviors. Pain assessment. Dementia patients often cannot express pain verbally, so nurses must use alternative methods, such as observing facial expressions, body language, and physiological signs of distress. End-of-life decisions. With advanced dementia, making decisions about life-sustaining treatments becomes complicated. Nurses must work closely with the family to align the care plan with the patient's wishes, as outlined in the advance directive or through substituted judgment. Mr. Johnson, a 75-year-old man with terminal cancer, is admitted to hospice care. His family is unsure about his wishes regarding life-sustaining treatments, and Mr. Johnson has never completed an advance directive. What steps should the hospice nurse take to address this situation? Answer: the hospice nurse should take the following steps. Assess Mr. Johnson's understanding and wishes. The nurse should initiate a conversation with Mr. Johnson, assessing his cognitive status and ability to express his wishes. If Mr. Johnson is still capable, his preferences regarding life-sustaining treatments should be discussed. Engage the family. The nurse should also engage the family, asking about any discussions or cues Mr. Johnson might have given in the past regarding his preferences. It's important to consider family dynamics and their role in decision-making. Facilitate advanced care planning. If Mr. Johnson is unable to express his wishes, the nurse should guide the family through the process of creating an advance directive, ensuring they understand the options available, such as life-sustaining treatments or comfort care. Document the decisions. Once decisions are made, the nurse should ensure that the advance directives are properly documented in Mr. Johnson's medical record and that they are available to all healthcare providers involved in his care. What are the challenges and strategies when providing palliative care for patients with multiple chronic conditions, e.g., heart failure, COPD, diabetes? Answer: providing palliative care for patients with multiple chronic conditions is challenging due to the complexity of managing symptoms and coordinating care. Key challenges include symptom management. Each chronic condition may have overlapping symptoms, e.g., pain, shortness of breath, fatigue, requiring the nurse to prioritize and manage them without exacerbating one condition at the expense of another. Medication management. Polypharmacy is common in patients with multiple chronic conditions. Nurses must ensure that medications for one condition do not interfere with those for another, and they must carefully monitor for adverse drug interactions. Coordination of care. A multidisciplinary approach is crucial. The nurse must work closely with physicians, social workers, and other healthcare professionals to ensure comprehensive care, which may include home visits, rehabilitation services, and community resources. Relevant guidelines. The American Academy of Hospice and Palliative Medicine (OPAM) emphasizes the importance of a holistic approach to care in patients with multiple chronic illnesses, prioritizing quality of life and symptom management. What are the key components of advanced care planning, and why is it essential for patients receiving palliative care? Answer: key components of advanced care planning include goal setting, identifying the patient's goals for care, such as whether they prioritize comfort, quality of life, or prolonging life. Documenting preferences. This involves completing legal documents such as living wills and appointing a healthcare proxy through a durable power of attorney (DPOA). Discussing life-sustaining treatments. Patients should have a clear discussion about their preferences for interventions such as CPR, mechanical ventilation, and feeding tubes. Regular updates. Advanced care planning should be a continuous process, particularly for patients whose conditions change, requiring the family and healthcare team to revisit and adjust the care plan. Why it's essential. Advanced care planning ensures that patients' wishes are respected, particularly in situations where they may be unable to communicate. It reduces the burden on family members and healthcare providers by providing clear guidance about the patient's preferences. What are the critical steps a hospice nurse should take to ensure a smooth transition for a patient moving from a hospital setting to home hospice care? Answer: critical steps include comprehensive discharge planning. The hospice nurse should coordinate with hospital staff to review the patient's medical records, including current medications, care needs, and the patient's prognosis. Family education. The nurse should provide thorough education to the family about the patient's needs at home, symptom management, and the roles of home care providers. Coordinating with home care teams. The nurse should arrange for home care services such as visiting nurses, home health aides, and respiratory therapists as needed. Ensuring support resources. The nurse should make sure the family has access to resources such as hospice support lines, counseling, and respite care options. Relevant guidelines. The Centers for Medicare and Medicaid Services (CMS) provide guidelines for care coordination during transitions, emphasizing the need for communication among healthcare providers and the family to reduce hospital readmissions. What are the unique considerations when providing palliative care for a patient with a mental health disorder such as depression or schizophrenia? Answer: unique considerations include mental health management. Mental health disorders may affect the patient's ability to understand their condition or make decisions. Nurses should collaborate with psychiatrists to ensure proper management of medications for mental health and assess for side effects that could impact palliative care. Building trust. Patients with mental health disorders may be more prone to anxiety, confusion, or mistrust. Establishing trust through clear, consistent communication and compassionate care is essential. Symptom management. Mental health disorders can complicate the management of physical symptoms such as pain. Nurses should be mindful of how mental health affects symptom reporting and treatment efficacy. Relevant guidelines. The National Institute of Mental Health (NIM) provides guidelines on managing palliative care for patients with mental health disorders, ensuring an integrated approach to care. What are the key principles when providing palliative care to elderly patients with complex healthcare needs? Answer: key principles include comprehensive assessment. This includes a thorough assessment of the patient's physical, psychological, and social needs, taking into account the complexity of aging and multiple comorbidities. Person-centered care. Care should be tailored to the patient's preferences and goals, which may shift depending on their prognosis and functional status. Family and caregiver support. Older adults often rely on family for support, so the care plan should also address the needs of caregivers, providing them with education, respite care, and emotional support. Relevant guidelines. The American Geriatric Society recommends a multidisciplinary approach to geriatric palliative care, integrating various healthcare providers to address the complex needs of older adults. What is the role of case management in hospice and palliative care, and how does it improve patient outcomes? Answer: the role of case management includes care coordination. The case manager ensures that all aspects of care, Physical, emotional, spiritual, and social are effectively coordinated among the patient's healthcare team. Resource management. The case manager identifies resources such as home health aides, durable medical equipment, and financial assistance programs. Advocacy. Case managers advocate for the patient's needs, ensuring that the patient's wishes are respected and that they receive appropriate care throughout the course of the illness. The impact on outcomes. Case management leads to better patient satisfaction, improved symptom management, and more efficient use of healthcare resources. Relevant guidelines. The National Association for Home Care and Hospice (NOC) emphasizes the importance of case management in improving the quality of hospice care and ensuring that care is patient-centered and coordinated. What is the role of the interdisciplinary team in hospice and palliative care, and how does effective collaboration between the team members improve patient outcomes? Answer. The interdisciplinary team in hospice and palliative care includes physicians, nurses, social workers, chaplains, therapists, and volunteers, all of whom bring specialized knowledge to address the physical, emotional, social, and spiritual needs of patients facing serious illness. The goal of the interdisciplinary team is to provide holistic care that maximizes quality of life for patients and their families. Effective collaboration involves regular communication and the sharing of insights about the patient's condition, treatment options, and personal preferences. The team conducts care planning meetings, which help to develop individualized care plans based on the patient's needs, values, and goals. By working together, the team can minimize the risk of fragmented care, improve the patient experience, and enhance satisfaction with hospice services. Proper documentation and continuous assessment ensure that all team members are aligned in their care efforts. Explain the importance of quality indicators in hospice care and how do they influence patient safety and care delivery? Answer. Quality indicators are measurable aspects of care that reflect the effectiveness, safety, and patient satisfaction of hospice services. These indicators are used to evaluate and improve care delivery by identifying areas where improvements are needed. Examples include pain management, patient comfort, symptom control, and patient or family satisfaction. Importance in patient safety and care delivery. Quality indicators allow for continuous monitoring of patient outcomes and treatment efficacy. They are used to ensure that standards of care are met and to identify potential risks or safety concerns early in the process. By tracking these indicators, hospice providers can identify trends in care quality, enabling timely interventions and adjustments to care plans. Hospices are often required to submit data on quality indicators to accrediting bodies or regulatory agencies, which helps maintain compliance with federal and state regulations. Which steps should a hospice nurse take if they observe a sudden and unexplained change in a patient's condition that could indicate a potential safety risk? Answer. When a nurse observes a sudden and unexplained change in a patient's condition, the following steps should be taken. Assess the patient. Quickly assess the patient's physical and mental status to understand the nature of the change. This includes checking vital signs, conducting a pain assessment, and evaluating the patient's comfort levels. Notify the physician. Immediately inform the attending physician or palliative care team about the change in condition. If needed, escalate to emergency care depending on the severity of the symptoms. Document the findings, record the patient's condition, the changes observed, and any actions taken in the patient's medical record. Implement safety measures. If the change presents a risk e.g. falling, dehydration, implement safety measures such as adjusting the environment, ensuring proper hydration, or offering additional support. Follow hospice protocols. Hospice organizations have specific protocols for dealing with potential risks to patient safety. Nurses should follow these protocols and report the situation to management for further investigation if needed. Mr. Roberts is a 75-year-old male admitted to hospice care with terminal cancer. He is experiencing increasing pain that has not been fully alleviated by the current medication regimen. What actions should the hospice nurse take in this scenario to address the patient's pain management effectively? Answer. The hospice nurse should take the following actions to address Mr. Roberts' pain management. Reassess the pain. Conduct a thorough pain assessment using standardized tools such as the Numeric Rating Scale (RS) or the FACES Pain Scale. Review current medications. Check if the current medication regimen e.g. opioid pain relievers, adjuvant drugs is adequate for the level of pain reported. If necessary, consult with the attending physician to adjust the dosage or type of pain medication. Consider non-pharmacological interventions. In addition to pharmacological treatments, consider non-pharmacological interventions such as massage therapy, guided relaxation, music therapy, or acupuncture depending on the patient's preferences and comfort. Patient education. Educate Mr. Roberts and his family on the nature of pain management in hospice care, emphasizing that the goal is to provide comfort, not cure, and that adjustments to pain relief strategies are common. Consult the interdisciplinary team. If the pain remains inadequately controlled, convene the interdisciplinary team, including a palliative care physician and pharmacist, to explore alternative treatment strategies such as nerve blocks or adjunct therapies. A hospice team regularly holds care conferences to evaluate patient progress. What is the primary benefit of these case conferences, and how do they enhance the quality of care provided? Answer: the primary benefit of care conferences in hospice care is to ensure comprehensive, coordinated, and individualized care for the patient. These conferences allow each team member, including physicians, nurses, social workers, chaplains, and others, to contribute their expertise and perspectives to the patient's care plan. Enhancements to quality of care. Holistic review. The team can reassess the patient's physical, emotional, social, and spiritual needs, ensuring all aspects of the patient's care are addressed. Shared decision-making. It provides a platform for discussing treatment options, symptoms management, and goals of care, ensuring that care decisions align with the patient's wishes and preferences. Increased collaboration. By facilitating open communication among disciplines, care conferences help reduce misunderstandings and ensure that everyone is on the same page regarding the patient's care. Case conferences also provide an opportunity to adjust care plans as the patient's condition changes, leading to more timely interventions and higher quality care. What role does a hospice social worker play in managing the psychological and emotional needs of a patient and their family? Answer: a hospice social worker plays a critical role in providing emotional and psychological support to patients and their families. The social worker helps patients cope with the emotional challenges of end-of-life care, including feelings of anxiety, fear, and depression. The social worker also assists families in managing stress and grief associated with terminal illness. Key responsibilities: psychosocial assessment. Social workers assess the patient's and family's emotional state, identifying stressors such as fear of death, unresolved family issues, or financial concerns. Counseling. They provide individual or family counseling sessions to help manage grief, loss, and anticipatory mourning. Crisis intervention. In cases where the patient or family is experiencing acute emotional distress, the social worker offers crisis intervention strategies, connecting them with appropriate resources if needed. Advanced care planning. They facilitate discussions about end-of-life wishes, including advanced directives, living wills, and do not resuscitate DNR orders, ensuring that the patient's desires are respected. How does quality improvement, Kai, contribute to better patient outcomes in hospice and palliative care? Answer: quality improvement, Kai, in hospice and palliative care focuses on continuously improving the processes of care delivery to enhance patient outcomes. By systematically evaluating care practices, identifying areas for improvement, and implementing changes, QI initiatives contribute to more effective, efficient, and compassionate care. Key concepts: data-driven decision-making. QI programs rely on data collection and analysis to identify trends, measure performance, and highlight areas that require attention. Process standardization. QI efforts help standardize best practices, reducing variations in care that can negatively impact patient outcomes. Patient-centered care. QI ensures that care remains patient-centered by aligning treatments and interventions with the patient's preferences and goals. Hospices often utilize quality indicators, patient surveys, and audits as part of QI programs to monitor care effectiveness and patient satisfaction. A hospice nurse is responsible for conducting a clinical audit. What are the essential steps in performing an effective clinical audit in hospice care? Answer: performing an effective clinical audit involves the following essential steps. Planning. Identify the area of care to be audited, such as pain management or patient safety. Define clear objectives and establish the criteria for assessment. Data collection. Gather data from patient records, interviews, and observations. Ensure that the data collected is comprehensive, accurate, and representative. Analysis. Compare the collected data with established guidelines, standards, or benchmarks. Identify areas of non-compliance or potential improvements. Reporting. Prepare a detailed report outlining the audit findings, including any gaps or issues identified, and recommend actions for improvement. Implementation of changes. Work with the interdisciplinary team to implement changes based on the audit findings and monitor the impact of these changes on patient care. Regulations. Clinical audits are essential for complying with the CMS, Centers for Medicare and Medicaid Services, conditions of participation and ensuring the hospice meets quality standards. How should hospice nurses address patient complaints regarding pain management, ensuring they follow regulatory guidelines and maintain patient safety? Answer: hospice nurses should take a systematic approach to addressing complaints about pain management, ensuring the patient's concerns are heard, investigated, and resolved. Listening and empathy: the nurse should listen attentively to the patient's complaint, express empathy, and validate the patient's experience. The nurse should assure the patient that their pain will be addressed promptly. Assessment and review: conduct a thorough assessment of the patient's pain, review their current medication regimen, and check for any potential issues that might contribute to an effective pain control. E.g., incorrect dosing, side effects. Collaborate with the team. If necessary, consult with the physician and interdisciplinary team to adjust the care plan, including medication changes, alternative therapies, or new interventions. Documentation: document the patient's complaint, the assessment process, and any changes made to the care plan. This ensures compliance with quality standards and legal regulations. What steps should a hospice organization take to ensure compliance with federal and state regulations concerning patient care and safety? Answer: a hospice organization should take the following steps to ensure compliance with federal and state regulations. Adopt evidence-based practices. Ensure that all care protocols are based on current evidence-based guidelines and best practices for hospice care. Training and education. Regularly train staff on regulatory requirements, patient safety standards, and ethical guidelines to maintain a high level of compliance. Audit and monitoring. Regularly conduct internal audits and assessments to ensure that care practices align with regulations, identifying areas for improvement. Patient and family involvement. Ensure that patients and families are informed of their rights, including their rights to file complaints and access quality care. Documentation and reporting. Maintain thorough documentation of patient care and report any incidents or compliance issues to regulatory authorities as required. Regulatory guidelines. Compliance with CMS conditions of participation and HIPAA, Health Insurance Portability and Accountability Act is mandatory for ensuring legal and regulatory adherence in hospice care settings. A patient with advanced cancer has been informed of their prognosis and is struggling with feelings of hopelessness and despair. What are the most effective psychological interventions that can help this patient cope with their emotions, and how can the nurse assess whether these interventions are effective? Answer: effective psychological interventions for terminally ill patients include cognitive behavioral therapy (CBT) and narrative therapy. CBT helps patients reframe negative thought patterns, which can reduce feelings of hopelessness. Narrative therapy allows the patient to find meaning in their illness by reauthoring their life story, making the terminal diagnosis feel less like an end. Nurses can assess the effectiveness of these interventions by observing changes in the patient's emotional state through structured tools like the Hospital Anxiety and Depression Scale (HANS). Also, the nurse should monitor verbal expressions of empowerment, as patients may begin to show a renewed sense of control. By using open-ended questions like, "How do you feel today?" Nurses can encourage emotional expression, which is vital in assessing progress. Additionally, caregivers should be involved in the process, as their responses and engagement can also affect the patient's emotional state. Cultural sensitivity is essential, as beliefs about illness and death vary widely across cultural contexts. A family member is experiencing complicated grief after the death of a loved one under hospice care, showing symptoms of persistent sadness, anxiety, and avoidance of reminders. How can a hospice nurse support this family member, and what interventions are appropriate? Answer: to support a family member experiencing complicated grief, the hospice nurse should provide emotional validation and encourage expression of grief. Reassuring them that their feelings are normal is crucial in reducing isolation. The nurse can also suggest professional counseling or refer them to a grief support group where shared experiences can provide comfort. Cognitive behavioral therapy (CBT) can be an effective intervention to help the individual challenge and manage intrusive thoughts and avoidance behaviors. The nurse should assess whether the family member is functioning in daily life and provide guidance on healthy coping strategies. Educating the family member about normal grief stages can help them feel understood and less overwhelmed. If symptoms persist or worsen, referral to a mental health professional specializing in grief counseling is essential. Nurses should also remain culturally aware, recognizing that grief expressions vary across cultures and respecting the family's cultural mourning rituals. Over time, continued support and follow-ups can ensure the family is coping adequately with the loss. Mr. Nguyen, a patient from a Vietnamese background, is nearing the end of life and wishes to include his extended family in all care decisions as is customary in his culture. How can the hospice nurse ensure that care is both culturally competent and respectful of these preferences while maintaining professional boundaries? Answer: the hospice nurse must first acknowledge Mr. Nguyen's cultural value of family involvement in care decisions. In many Vietnamese cultures, family is central and decisions are often made collectively. The nurse should facilitate family meetings to ensure that Mr. Nguyen's wishes are communicated clearly while also respecting the role of the immediate family. The nurse should educate the family about the medical situation while ensuring that Mr. Nguyen's individual preferences are central. The nurse can encourage open communication, ensuring that the extended family members are heard, yet also remind the family that Mr. Nguyen's autonomy and comfort are paramount. Cultural competence involves understanding that family dynamics influence care decisions and that the nurse must balance patient care preferences with the family's input. The nurse should also be mindful of the role of religion and spiritual beliefs in care, ensuring that any spiritual needs are respected and addressed, potentially involving spiritual care providers as appropriate. By maintaining professional boundaries and respecting cultural traditions, the nurse can provide effective, culturally sensitive care that aligns with the patient's values and needs. A nurse is working with a patient's family who has expressed disbelief and anger following the patient's terminal diagnosis. Which stage of Kubler-Ross's 5 stages of grief are they most likely experiencing, and what interventions should the nurse consider to support the family? Answer: the family is likely experiencing the stages of denial and anger from Kubler-Ross's 5 stages of grief. Denial is the initial response where the family may struggle to accept the terminal diagnosis, often questioning its validity. Anger follows, as family members may feel that the situation is unjust. Nurses can intervene by offering empathetic listening and allowing the family to express their feelings without judgment. Providing emotional support helps family members process these initial reactions. The nurse should clarify that these responses are typical and part of the normal grieving process, ensuring the family feels validated. Education on the grieving process can help normalize their reactions. The nurse can also offer specific coping strategies, such as relaxation techniques and opportunities for family counseling. By providing reassurance, the nurse can help the family move toward acceptance and foster a more supportive environment. Encouraging communication and allowing time for grief expression helps alleviate the emotional burden. Cultural competence is crucial, as each culture may express grief differently, and the nurse should respect cultural mourning practices during this process. Mr. Rodriguez, a Spanish-speaking patient, has recently been admitted to hospice care. His family insists on continuing to provide care at home, despite the nurse's recommendation for inpatient hospice care due to the patient's increasing symptoms. How should the nurse navigate this situation while respecting the cultural values of Mr. Rodriguez's family and ensuring the patient's needs are met? Answer: the nurse should first acknowledge the family's cultural preference for home care, as it is often viewed as a more personal and respectful way to care for a loved one, especially in Latino cultures. The nurse should listen to the family's concerns and explain the reasons for inpatient care, such as better symptom management and more frequent monitoring. A culturally sensitive approach involves discussing how inpatient care might enhance the patient's comfort and quality of life. The nurse can also explore options for home hospice care, which might provide a compromise by increasing home visits or offering home-based medical equipment. It's important that the nurse makes sure the family understands all options and allows them to make an informed decision. Offering information in Spanish using an interpreter if needed can ensure that communication is clear. The nurse should continue to be sensitive to the family's needs and involve the patient as much as possible in the decision-making process, respecting both their wishes and the family's role in care. What are some key considerations when conducting a psychological assessment for a patient in hospice care, and how can the nurse integrate these findings into the patient's care plan? Answer: psychological assessment in hospice care should consider emotional, cognitive, and behavioral responses to terminal illness. The nurse must assess the patient's level of distress, signs of depression or anxiety, and cognitive function. Tools like the Hospital Anxiety and Depression Scale are useful in quantifying symptoms. Additionally, assessing the patient's coping mechanisms, such as their ability to accept the diagnosis, is essential. Nurses should also explore spiritual and existential concerns, which are common in terminal illness. The findings from this assessment help guide care by allowing the nurse to tailor interventions to the patient's psychological state. If symptoms of depression or anxiety are identified, referral to a mental health professional is necessary. Coping strategies such as relaxation techniques or guided imagery can be introduced. The nurse should ensure that care is individualized by incorporating the patient's emotional needs into the overall care plan, ensuring that both physical and psychological aspects of care are addressed in a holistic manner. Ongoing reassessment is important to track changes in emotional or cognitive functioning, especially as the patient progresses through the stages of illness. A patient diagnosed with a terminal illness expresses feelings of helplessness, and their family seems to be emotionally overwhelmed. What interventions can the hospice nurse employ to help both the patient and the family cope with the terminal diagnosis? Answer: the nurse should first assess the patient's emotional state, providing a space for them to express their feelings. Validating the patient's emotions helps reduce feelings of isolation. The nurse can introduce coping mechanisms such as relaxation techniques, guided imagery, and support group referrals. For the family, the nurse should acknowledge their distress and offer strategies for supporting their loved one while caring for their own well-being. Encouraging family members to practice self-care is essential, as they may be neglecting their own emotional needs. The nurse can educate the family on the stages of grief and provide resources for grief counseling. Open communication with the family about the patient's prognosis, goals of care, and preferences can help them feel more empowered and involved. And offering opportunities for spiritual support can also assist in emotional coping, particularly for families who find comfort in faith-based practices. It is essential that the nurse provide culturally appropriate interventions, as coping strategies may differ significantly across cultural backgrounds. Collaboration with the interdisciplinary team ensures that both the physical and emotional needs of the patient and family are addressed holistically. In what ways can the spiritual care provider enhance the quality of life for patients in hospice care, and how can they work with the interdisciplinary team to ensure comprehensive care? Answer: spiritual care providers support patients by addressing existential concerns, offering emotional support, and facilitating spiritual rituals or practices. They help patients explore meaning in their lives and cope with fears about death. Spiritual care providers can work with the interdisciplinary team by sharing insights into the patient's spiritual and emotional needs, helping to incorporate spiritual elements into the care plan. They may also offer guidance on how to address spiritual distress, such as the fear of dying or unresolved existential issues. Spiritual care is integrated into the patient's care by ensuring that the patient's beliefs and practices are respected and included in decision-making. This collaborative approach helps ensure that all aspects of the patient's well-being are addressed, providing a holistic care experience. The spiritual care provider can also guide the family in managing their grief and supporting their loved one. This comprehensive approach ensures that patients feel comforted and supported during the end-of-life journey. How can hospice nurses assess and address the spiritual needs of patients and their families in a respectful and sensitive manner? Answer: nurses can assess spiritual needs by asking open-ended questions like, what gives your life meaning? Or are there any spiritual or religious practices that you find comforting? It is essential to ask these questions with cultural sensitivity, respecting the patient's beliefs and practices. Once the patient's spiritual needs are identified, the nurse can provide referrals to chaplains or spiritual counselors who specialize in hospice care. Nurses should also ensure that patients have access to spiritual resources, such as sacred texts or rituals. Addressing spiritual distress involves listening actively and empathetically to patients' concerns about the meaning of life, the process of dying, and their legacy. Nurses can facilitate discussions that help patients express these concerns. For families, the nurse can encourage open communication and ensure they are supported in their own spiritual needs, which may include involvement in religious ceremonies or counseling. This holistic approach ensures that both the patient and family experience a meaningful and supported end-of-life journey. A patient from an African American background expresses reluctance to discuss their diagnosis and treatment options, fearing that it may be a sign of losing hope. How can the hospice nurse navigate this cultural barrier while ensuring the patient's needs are met? Answer: the nurse should first acknowledge the cultural significance of hope and resilience in African American communities. Many African Americans view discussing death as a taboo or believe that it may invite bad luck. The nurse should approach the situation gently, showing respect for the patient's reluctance while explaining that discussing care options is part of maintaining control over their situation. The nurse can emphasize that having discussions about the future is not a sign of giving up, but rather an opportunity to ensure comfort and quality of life. Acknowledging the patient's values and offering reassurance can reduce anxiety. The nurse may also involve the family in the conversation, as family dynamics often play a significant role in decision-making. Ensuring that the patient feels heard and respected without pushing them into uncomfortable conversations is key. The nurse can also offer spiritual support or refer to chaplain services to address any religious concerns related to the patient's illness. By incorporating culturally sensitive care, the nurse ensures that the patient's dignity and preferences are maintained while providing the best possible care.